I know you're excited about our guest today.
I am. I cannot wait to learn more. Today's guest is a legend in oral and maxillofacial surgery. There we go. Say that 10 times fast. Dr. Robert Marks, a decorated veteran, groundbreaking researcher, and award winning educator. Dr. Marks has pioneered innovations like platelet rich plasma and bone regeneration techniques now used worldwide with over a dozen medical textbooks, 130 plus peer reviewed paper. I cannot wait to interview you, Dr. Marks. This sounds incredible. And Neil, how did we get him on the show? This is great.
No, Dr. Marks is a client of mine. We've worked together for years, and he just is absolutely, and he's now, Dr. Marks, you're about to finish a book that's more on the medical side, right? What book is that?
Yes, it's entitled 28 Life-Changing Patients, Chronicles of an Oral and Maxillofacial Surgeon. Kelly, you're very right. We have a name from our profession that's really hard to pronounce, but
Mm-hmm.
basically we're head and neck. We are dual specialty of dentistry and medicine.
Okay, really neat. So tell me something about these different patients that really inspired you to write the book.
Well, uh, these are patients who were special patients, one of which was the first patient on the doctor's show, the talk show that came out of CBS. It was a little girl from Vietnam who we removed a 12-pound, 9-ounce tumor of her tongue.
Ooh.
The issue was very interesting because of its size and the fact that when she came to us, my co-surgeon, Dr. Jesus Gomez, and I got on TV, and we uh, arranged about $232,000 of donations for her. We gave her human growth hormone. She grew 2 inches in height. Her head
Hmm.
was cocked to one side because of the weight of this massive tumor. We had my orthopedic colleague straighten it out. But the reason I put that one in the book is that after uh, she was here for about 2 years for that treatment that we had to give her, human growth hormone and the like, I got a call from the president of the University of Miami, Donna Shalala at that time, a name that most people can recognize, and said that, well, the Vietnamese government is contact the council that you're pirating patients out of Vietnam.
Ooh.
I was taken aback by it, but she was very supportive. She said, "Well, tell me what I can do to tell them that why did you need to be here so long?" So, well, after her surgery, we had to do some reconstruction. We also had to use the human growth hormone, and so no good deeds goes unpunished. So we were punished by a claim that we were pirating patients. As it turned out, uh, she put that to rest. And then 12 years later, I got a picture from her from a computer operator out of Dallas who was visiting Vietnam and showed me a picture of her. Looked beautiful to this day. And for the first time could eat, had friends, and went to school. So those are some of those life-changing patients that are dear to our hearts. There's several more in the book like that.
And
Go
tell
ahead,
me
Kelly.
about, oh yeah, tell me about the STEM research. I think this is really, really interesting work. If you can elaborate a little bit more on that.
Yes, sometimes at our medical conference, I can brag and say, I can replace your entire lower jaw just with stem cells and something called recombinant human bone morphogenetic protein. So rather than take a chunk of bone out of your leg or your hip bone, which we were doing many years ago. So throughout the 1980s, I'm that old, and the 90s, we did the animal studies on this recombinant human bone morphogenetic protein. It
Hmm.
then went through 3 FDA clinical trials. I presented it to the FDA. It's unanimously approved. What this is recombinant technology. BMP, bone morphogenetic protein. These are big names, and I'm sorry to put them up on you.
No, no. Go ahead.
Develops your entire skeleton where you're developing embryo by recombinant technology by people smarter than me, a guy named John Wozni, clone that protein so that we can put it in along with stem cells, and the stem cells will tell that the protein back and forth what to do, how to develop into bone. So today we can rebuild jawbone and other bones. It's applicable throughout the entire skeleton. So that was a real game changer, so to speak.
It sounds
So
like a game changer, Dr. Marks. And ultimately, what made you kind of want to get into this research? Thinking about specifically enough you uh, successful at what you did, but adding that research component and to look at really being more groundbreaking than just some oral maxillofacial surgeons that just perform.
Well, yeah, it was a stimulus that I read some of the giants in our profession before, and I looked at the patients we were treating. That was treating cancer patients, gunshot wound people who lost a lot of bone, and we're taking large amounts of bone from another part of their body to put it up into the head and neck area. And of course, they would have uh, post-operative complications sometimes. They would limp. They would have difficulty healing. So essentially, it was to eliminate the morbidity of surgery. So if you use the old technique, people are in the hospital 5 days. If you use stem cells and BMP, they're in the hospital just 1 day.
wow.
So it saves the healthcare system a lot of money. It saved the patient a lot of pain and anxieties. So I've been into so-called growth factors for a long time. Platelet-rich plasma is probably the most well-known one of all, called PRP.
Hmm. So can they, do you know, because I know we're talking about bone, can they make organs now?
Yes and no. That's much more complicated. Uh, Tissues like cartilage and like bone we can make.
Okay.
Organs are much more complicated. They're decades away because you take an organ like a kidney.
Hmm.
There's certainly the filtering mechanism, but there's blood vessels that go through. There's lymphatics that go through them.
Hmm.
So it takes multiple growth factors and in a situation, a culture medium where you can do this. Will it happen? Yes, it will. But that technology is not yet there. And people who say it's right around the corner, I think, are misleading us. It's several decades away.
Okay. So do you use this technique with like cleft palate and things like that as well?
Oh yes,
Yeah.
yes.
Okay.
In I did when I was in the United States Air Force, I ran the craniofacial development board, and we saw a lot of kids, 6, 7 years old, with alveolar clefts. That's right here between,
Hmm.
right in the corner of the mouth. And we would take bone from these little kids. Uh, of course, kids heal pretty well, but now we just use the BMP, and we don't even, and you can use platelet-rich plasma. You don't even need stem cells because they have enough stem cells. So yes, we use it on those people all the time, and it's a great advantage not to have a child with a big scar over their hip.
Yeah,
Wow. You're
absolutely.
doing such great work. Is that part of the whole idea, Dr. Marks, that you really wanted to be a leader, as you talked about, but really help? And that's what the book is about, the stories of transformations that you were able to do as a surgeon.
The book is about some of these crazy war stories, as we call them. Some of these are in the emergency room where a guy came in claiming he had ringing in the ears, and the medicine people did a 4 to 5 hour workup on him and did a lot of enzyme studies. It turned out that he had a mosquito in his ear. So
Oh,
Mm.
some of those, that's what's causing the ringing in his ears. So I looked into his ears, and this poor mosquito was on his in his earwax stuck. And every once in a while he would start flapping his wings, and the poor man said, "Yeah, that's the ringing in my ears." So some of these are just oversights and crazy stories. Some of them are dramatic, if you will. People came in emergency room, and other such things. So it's for everybody. It's not for just my fellow colleagues. It's a book that is going to be interesting and fascinating to most anybody who reads it. It's
I think
written
that
for the
they're,
layman.
yeah, great stories. I think the mosquito one is pretty funny. Sometimes we try, it's a simple solution to the problem, right?
Yes, yes, that one was. So some of these are like there. There was another crazy story where I was referred to a person who had polyarthritis neuralgic. Okay, it's a big long name. Every joint in his body ached. He was in the Navy when it happened. He was a complete disability. He was making. He had a primary care caregiver with him all the time. He comes in a wheelchair with every brace on him. I'm supposed to look at his jaw joints. We had a discussion. He went back to Sausalito, California, and was going to come and live in Miami. I didn't hear from him for 6 months. So the caregiver finally said, well, we've kind of dismissed him because I went to his apartment and his wheelchair was on the sand and all of his braces were off and he was playing volleyball with a bunch of friends out there on the beach. And he
Oh,
was supposedly crippled, raking the government of
oh,
millions of dollars in a settlement. They linked it to some wisdom tooth removal when he was in the Navy. So some of these stories are like that, but most of them are biologic in nature.
wow. Well, in working in dietetics and clinical, we worked very closely with speech path and with everyone. So food consistencies and everything, making sure that they were right as you went through cancers. I know you were talking about that as well, and the removal of, tongues or esophagus, and how we were able to feed people. So what you do was directly tied into that clinical dietitian role and how we were able to get people food.
Oh yes, we have a connection with that because uh, I use growth factors to support wound healing, and I've lectured all the time. As physicians, we have to consider ourselves humble. We don't heal wounds. Mother Nature does. We just try to get things out of the way that interfere with it. So
Mhm.
almost every one of my cancer patients had a nutritionist or dietitian follow them, and it made a big difference. All of my growth factors don't work unless you've got the basic building blocks to build protein mainly and blood vessels and things like that. So yeah, that's this connection that I've had great respect for your profession.
Oh, thank you. It's nice to hear. I appreciate it. My husband started in when we first started dating. I was working in bariatrics, and he was around the hall in wound care. And one day he asked me, he's like, "Do you have any, information I could be giving these people?" And I'm like, "Yes, there's a lot."
Yes.
Iron and zinc, and making sure that they're getting enough and proper, like you said, proper nutrition was a huge piece in the wound healing part. So he was really grateful that we had all of this information that he could start delivering to
Oh,
people.
indeed. In fact, uh, just going to ask you, when we've done chemical analysis of a lot of our patients, the two things I found that almost everybody was deficient in was magnesium and vitamin D. Have you found something similar?
Yeah, so in bariatrics, we used to test people after the surgery. And so we thought that the surgery was causing the deficiencies. But then we started testing them prior. And I would say probably 97% of clients for vitamin D deficient. Plus, we live in the Northeast, so it makes sense. But it's interesting of how low. Magnesium is still not one that is generally tested for, which is too bad. Not a lot of general practitioners are testing for magnesium, but we know that's one of the missing nutrients in our bodies.
Yeah, that seems to be a key one, particularly related to muscle function that we have found. Yeah, that's speaking of bariatric surgery, my bariatric people were always the busiest people in the hospital. Uh, what is your take as a nutritionist about the GPL-1 inhibitors such as Wegovy and Ozempic? Can you really prevent the protein wasting that we see with them? Because I've seen that.
Yes. So it's interesting, Dr. Marks, that I actually wrote the book on it. So it came out in December, and how nutrition needs to be directly implement with it. Like if you're going to be taking a GLP-1, you need, like you were saying, to have a dietitian with you to understand how much protein and fiber and nutrients and vitamins. What we're finding is that the GLP-1s work so well that people are truly not hungry on any level. They're not eating food, and therefore they're seeing major deficiencies, and one of those being a low protein, which is leading to that muscle wasting. So it's very interesting, and so that's what our whole book is about. So thank you for the plug. But that's what the book is about, called The New Weight Loss Era. And we're very fortunate. A brand new research article came out just a year ago, July of 2024, that really talked about how much protein and fiber and nutrients you need to have while taking a GLP-1.
Are there any special proteins that address muscle wasting better than others?
Well, when we really talk about those nine essential, and so your body does not make those nine essential amino acids and your body can't store them. So, this is where understanding that protein needs to come in evenly throughout the day at breakfast, lunch, and dinner. So, when we get into the GLP-1 space or intermittent fasting or all these different things, people are not getting the protein they need to fill up their tank, basically. And so if you're not getting enough, and then something else that we're seeing, if people are choosing to go vegan, they're also could potentially not be getting all nine essential amino acids. So we have a lot of these things out there that we want to give the education. Like, you can eat healthfully as a vegan, but it really does take a ton of knowledge and education on how to do the pairings of protein. So between the intermittent fasting, the veganism, the GLP-1s, dietitians are needed more than ever.
Oh, you are absolutely right. Because my concern about Wegovy and these is it's just too easy. I've been doing a group of podcasts about dietary supplements, and there's so many out there with really kind of bogus claims that has me concerned that the general public is reaching for a crutch. Okay, I'll just take Wegovy and I'll be all right. I know it's much more complicated than that. So I agree with you. We'll support that. I think dietitians now play a much more potent role in these weight loss gimmicks that are going on out there.
Me too. I do too. I mean, I loved my work in bariatrics. People always ask, like, how do I feel about that? And I feel the same way about bariatrics that I do with GLP-1s. I have no opinion. That's between you and your medical doctor and between you and you. We're here to educate. So if you're choosing to, have whatever done, you still need the education on how to fuel your body
Yes.
to do that. Right.
Yeah.
So we have a no judgment policy. We're here to truly educate and to get people the best advice.
Oh, that's
Yeah.
great. Now, another love of mine, or maybe it's a hate-love relationship, is osteoporosis. I've been a consultant to almost every osteoporosis manufacturer, and I will tell you that their research is a bit sketchy. I've been somewhat critical of that. So, one of the problems I see with osteoporosis is everybody focuses on the mineral because I'm a bone geek. And that's only half the equation. Bone is collagen, bone is protein. And so almost all of the osteoporosis medications, which is a $20 billion a year market, almost every woman over 50 is taking some osteoporosis medication. And I don't have any great data on it, but in my opinion, more than half of them don't need it. Uh, Nutrition and osteoporosis. Can you give me some insights into that?
Well, exactly what you just said, bone in the way of collagen, protein, and also making sure it has enough nutrients and vitamins in the right portion. So again, going back to my bariatric days, we used to give people tons and tons and tons of calcium because again, they thought that when people went through the bariatric surgery, that it was causing bone loss. Well, actually, they were carrying around an extra 200 pounds. So that amount of pressure was keeping those bones healthier. It wasn't when we gave them tons of calcium, it was just pulling out more of the minerals into the bone. It was not working. And also, there wasn't resistance training. So I think we've learned so much about what you were saying with magnesium and calcium and vitamin D and how all of this kind of works together. It's not just taking this one thing or taking this one medication that's going to actually prevent bone loss. It really is a holistic approach.
Oh, you are absolutely right. And I learned that more. I feel bad that I'm as old as I am because there's a lot of new great things going
There
on. And
is.
to me, I'm still doing research with our stem cell group, and that's been very exciting. But we're just scratching the surface. This is the
We
very
are.
beginning of stem cell knowledge.
We are. And so that's where I was on a walk with my friend this morning, and they're doing a whole bunch of research right now on estrogen. And as women go through perimenopause, of getting on estrogen along with a healthy diet can also help prevent that bone loss because we need that estrogen to do just that too. So there's a lot more emerging research, and I think the stem cells are super cool. I saved my daughter's cord blood when she was born, and they're doing a lot more around that on how it can help stimulate the pancreas if she was to get type 1 diabetes, or even help to prevent certain cancers. So it'll be interesting to see where we go in this world.
Yeah,
And see, Dr.
absolutely.
Marks, talk about what you're with the stem cell, the marrow marks.
Oh, well, like you have a book out, I have a book out. But years ago, about 2 years ago, we've developed an instrument with a brilliant engineer out of Naples. One of these things we were starting to write notes on napkins over dinner one time about 8 years ago, and so we developed what now is called the marrow marksman. And what it is, it's a small little puncture that goes into the hip, because we find out where the stem cells are in the hip. They're in one particular location in high concentration. So the engineering design seeks out that area and takes bone marrow stem cells. And that's what we use to regenerate bone, to regenerate cartilage. Again, I kind of retired before we started moving into soft tissue, like burns. There's a great need to accelerate skin healing in burn victims. So I'm leaving that for the next generation. But what we're doing is characterizing the stem cells to which are the best ones, because not one stem cell is like another. Some stem cells that we're talking about are not able to clone a human being, but there's some that can do an organ. But we're more into the easier ones, the tissue level, cartilage, bone. Nerve is going to be the most difficult one to do. Nerve is more complex than anything.
Well, I think if you can get into how to naturally get rid of wrinkles for females,
Yes.
you're
Yeah.
gonna hit a home run.
Oh, yeah. That's almost an undoable thing. But no, I thank you for your insights into osteoporosis, because it's a real entity. It involves so many million women today, and I think they're being overtreated with some of the medications out there. They have a lot more side effects than is admitted to. I've treated over 840 people with dead bone in the jaws due to Fosamax, if we could use that. So
Well,
yeah, there's
I hope that our profession steps up even more and we're able to educate more people on how we could prevent a lot of these different chronic diseases through nutrition education.
Yeah, stem cells have that role. I want to circle back to what you mentioned about estrogen. I think estrogen as a replacement has gotten a bad rap years ago
Yes.
about promoting breast cancer. That needs to be looked at again. That research is very, very sketchy, and there's nothing better than estrogen just improving your levels. Same thing with testosterone for males. As long as you're not overdosing people with it, like the professional wrestlers and some of the football players have done, to the point of cardiovascular disease. That's a dosing problem. And I think that if that can be worked out, estrogen, testosterone have a good role to play in men and women's health. Those various.
Agree.
Yeah, yeah. We
Wow,
have a
you
lot of
guys are great
agreement there.
connection. This is a great conversation. Two health professionals. I'm just sitting back and enjoying the conversation without Dr. Marks. I guess the final ad, what would you feel is the when your career, where the next step in healthcare is going? What do you see things with some of these things like the stem cells and all the things, these new ways to live a healthier life?
Uh, there's many ways, but I'll focus in on one I think that's very doable, and that's RFK, getting some of the toxins out of our out of some of our foods that we have. I think we are overdosed with some of the toxic dyes, over processing of different foods. I think I looked up some of Kelly's blogs about self-guided. I think I want people who look more at their kids' diets, kids' snacks, so that they learn very early on what a healthy diet is and get away from some of the things that are put upon us. You cannot walk through an airport today without smelling burgers, fries, Cinnabon, and a bunch of other things. So the temptations are there. The training has to be in younger people.
Yes.
Eat healthier, exercise more, despite the distractions of several things that we know
All
of.
right. Okay. We're soon. Dr. Marks's website will be up We'll have to put that in the show notes later after the fact. Appreciate it, Dr. Robert Marks. And you can go check out Kelly's book.
Yeah.
Where?
Amazon, the new weight loss era. So definitely. And thank you, Dr. Mark, so much. I've learned a ton and there's so much more to learn. So
Exactly.
Thank you for having me. It was
thank
fun.
you.
All right.